I was a 46-year-old, pretty healthy male. I was bike riding 100 miles a week to and from work. My bloods were perfect. Everything that I normally get checked at my annual exam was perfect. But in the manual exam by my physician, she felt under my rib cage and felt something that she thought was a little off. Unfortunately, it was a really large mass on my pancreas. I was diagnosed with a neuroendocrine tumor in 2007.
I was playing basketball. I was screaming and my teammates couldn't hear me on the court. I lost my voice for about 6 months. After going through a myriad of tests, they finally found out that my left vocal cord was paralyzed, and then a scan revealed that it was due to a tumor that had spread to the nerve feeding my vocal cord, which they eventually diagnosed as papillary thyroid cancer.
Did a blood test and my PSA was 52. Which led to other testing and them telling me that I had 4th stage cancer metastasized to my bones, which pretty much shocked me and scared me a little bit.
I was treated in 2009 and 10 and really set my disease back and changed the arc of my life and the path of my journey. With that, I have much of my life back.
I had surgery to remove my thyroid as well as over 30 lymph nodes that the cancer had spread to in my neck and upper chest. And due to the extent of the disease, they found out that it would probably be best for me to undergo additional treatment. And that was when it was recommended that I undergo radioactive iodine or RAI treatment, nuclear medicine therapy.
Theranostics, it's medicine that's programmed to go after the cancer cell and not destroy the rest of your healthy cells. Taking out the wolf, you might say, in the herd of sheep.
So after my radioactive iodine treatment, I had a scan that showed that I had no large measurable disease for thyroid cancer.
When I was diagnosed, there were very few options. We're now 8 years or 7 years post the gallium-68 approval for dotatate in this country, and how that has radically changed how those with neuroendocrine tumors, and there's over 200,000 of us in the United States, are treated.
So the really wonderful thing about radioactive iodine therapy is there really were no short-term or long-term side effects. I think we tend to think of the cancer patient as nauseous and throwing up because of these really toxic therapies. Fortunately, with radioactive iodine being so targeted, there were really minimal side effects.
The outcome of the treatment was hundreds of metastases erased from my body, so 100% success. Just a couple spots that were left. A few months later, I was snow skiing, knowing that there was 100% success there, and guided by my doctor, we made some decisions that way.
So for the newly diagnosed, I'll give you one big piece of advice. Relax, take a deep breath, enjoy every sandwich.
Understand that there is help out there for you. Just find a good nuclear oncologist. They'll steer you in the right direction according to your test results.